Tonight, pediatricians are warning parents with young children to watch out for symptoms that can be either the flu or RSV, a respiratory virus.
As 3 News anchor Mike Gillespie shows us, knowing the difference between the two could save you from making an unnecessary trip to the emergency room. Mike?
Boy, that is right. You know, overlapping symptoms can be quite confusing, especially for new parents. And while doctors say that there could be a reason to visit the ER, it's easier to make that call once you at least have an idea of what it is that you're dealing with ahead of time. Flu season typically starts in late winter, but according to the doctors at Driscoll Children's Hospital, this is not a typical year.
We're really seeing a big surge in some of the respiratory viruses that we normally see a little bit later in the year.
The cough, the sneezing, the runny nose. But it's the symptoms that show up in addition to those that can help determine whether a child has a cold, the flu, or the respiratory virus, RSV.
Our RSV tends to wheeze, to have a little whistle breathing in the chest, and to labor to breathe. The flu, they tend to look sicker. They spike the high fever, they get muscle aches and pains and headache.
Doctors say that because of the early arrival, more parents are using the emergency room, something that leads to longer wait times. But is an ER trip always necessary?
When there's a question, we want to encourage people to call their pediatrician and explain the symptoms, and then they'll be directed to go the right place first.
Not only does checking first with your family doctor cost less than an ER visit, but it can free up physicians to get to those patients who do have an immediate need more quickly. And one final encouragement.
While most of the time children can get through these viral illnesses without being in the hospital, sometimes they can be very serious. And we've got vaccines to prevent them, both for COVID and for flu, all the way down to 6 months of age.
Mike Gillespie, 3 News.